Hello guys, welcome back to the D&N Medical Series. I'm Damar and this is
Nikki.
and today we have a very special guest. Her name is Imani Hemmings and she's currently a fourth year medical student and she's just going to share her experience in third year and let us know how was it for her and what were some of the challenges and things like that. So we're just going to start by asking Imani to introduce herself or tell us a little bit more about her.
Hi everyone, my name is Imani Hemmings and as I said before, I'm currently in fourth year of the MBBS program at the UWI Mona campus. In my spare time, I enjoy playing the flute, watching makeup videos, just like a typical 22-year-old. And I'm here to just share with you my experience so far.
Okay, did you just say play the flute?
Yes, I play the
Oh,
flute. Yes, I was grade 4
mhm.
in high school. I kind of just play for fun now. I don't really do exams anymore.
Okay, okay. All right, wow. Girl of many talents.
Thank you.
So you just told us a little bit about yourself, but we want to dive down a little bit more in your background. Which high school are you coming from? And was being a doctor your career goal all your life, or did you just happen to say, okay, I think I like this one day?
So I attended Immaculate Conception High School where I did the sciences, chemistry, physics, biology, and I always said, okay, maybe medicine is the ideal career for me. I wasn't sure. However, my big sister, she did medicine, and after exploring, doing some research, I decided that maybe it's best to also do medicine as well.
No.
And yes, and when I had applied to UWI, I was looking out to be given the UWI Open Scholarship. And so it just further, I don't know, encouraged me to pursue this degree.
Okay.
Yeah.
So medicine runs in the family. Okay.
And and I guess with the open scholarship, everything would be like easier and stuff in terms of expenses and stuff. So it basically gave you the push or to basically confirm what you wanted to do or be. Alright,
Exactly.
so what were some of your expectations coming into medical school? What did you expect it would be like for you?
Well, I thought it was going to be like high school where you just read, go to classes, learn, and everything will come naturally and you just be on top of things. But it was not like that at all. Medical school requires you to come up with your own innovative ways to remember the material because it is a lot. When it comes to anatomy, learning the different blood vessels and nerve and all of that, it really comes down to how creative you can be with remembering the material.
Right. So as you said, oh, you have to come up with your own strategy and be innovative and everything. So give us some of the strategies that you use. What if I want to use some of those too?
Okay, sure. So I found myself drawing a lot, taking screenshots of pictures on Google, like if I should look up, for example, I remember I was struggling with the the nerve in the neck, and I found myself having to draw it over and over again. And YouTube, I can't stress enough. I love YouTube. Watching the videos helps a lot, tremendously. You can't depend on the textbook alone because I find that, especially with anatomy, it's such a visual, it's such a like tactile course. You have to draw, you have to look at the specimen, you have to take the extra time. And during my lunch breaks, I used to use that time and stay in the anatomy lab and do extra, go the extra mile and you pay it off.
Yeah,
That is
I
awesome.
understand. Because I really agree with you when you say anatomy takes a lot, as you said, with more physical and practical, and there are practical components of it. So you really need to be on top of your game when it comes to anatomy. Alright, so for preclinical, how was preclinical for you, and what was like the transition between preclinicals and clinicals? How was that for you?
So the preclinical experience, it was interesting.
Uh-huh.
The way that they tested in preclinicals was a lot more like regurgitating information or just remembering facts. It was still MCQ, they're still testing with MCQ in preclin and clinicals. However, when it comes on to clinicals now, they're gonna give you a case, a patient, and you have to think of a solution. You have to be more proactive in deciphering the answer. It's not as simple as just remembering a fact, remembering a formula, remembering a nerve. It comes down to being a lot more practical. It was a bit hard. Um, I remember going on ward round in third year, and it was a totally new experience because here you have someone, well, in lectures you just sit down and the lecturer will just speak at you. On ward round, they expect you to speak as well. They expect you to contribute to the treatment plans of the patient. They expect you to take notes, take history. And in that, you have to speak. You have to learn how to speak like a medical professional, which is something I'm still struggling with because it doesn't come naturally as yet. But with practice, it does take a lot of practice before you can finesse what they would like.
Wow.
Okay, I understand. So, would you say that you prefer preclinicals so far or clinicals? Which one do you
My
find most
God, uh,
I like it more?
ironically, I do prefer preclinical because it's just you just reading and just so shading the answer on the paper. But when it comes down to what is needed, what you're going to actually need for your career, clinicals is very important.
Right.
But I don't know, something about it is still hard.
That sounds like you're struggling, man.
it's it's different. That's the thing. And with something different, you have to find a different approach. Speak more. It's not about drawing again. You have to speak, really practice, and learn to use the instruments a lot.
Right,
Yeah.
right. So,
I guess
mm-hmm.
that's why it's called medical practice because over time I guess you become better at doing it.
Right.
And
Practice
yeah,
makes perfect after all.
yeah, yeah,
Yes.
right.
Right. Another question I have for you. You are in rotation now and you've completed preclinicals. So I want to hear your best and worst course in preclinicals and your best and worst rotation so far. And why?
Okay. And why? So what I'm remembering now in my preclinical years was the experience with FDT. I did not like that course, which is fundamental in disease
Yeah.
treatment. Oh my gosh, it was too much.
Uh-huh.
The pharmacology, the microbiology, I was like struggling with it. And I didn't enjoy it. I didn't see it like why do I need to learn all of this until now when I'm in clinical and I'm like, wow, it's all coming back. It's all very, very important. The fundamentals part in that course, it's true. It is fundamental. Um, and you asked me for my least favorite course in clinical.
Yes.
Mm-hmm. Lisa knows.
Boy, my least favorite course in clinical is kind of a tie between surgery and medicine. Surgery because I didn't expect it to be that labor intensive. It's a lot of standing between theater, ward rounds, and all of that. It's strenuous. And with medicine, it's a lot. Like patients come in with so many different conditions, and it's up to you to make the diagnosis. With surgery, the diagnosis is made for you, so all you do is okay, cut. With medicine, it's a lot more different. But those two, they're very important, but those two are harder for me.
Yeah, and I think I understand what you were saying because I had a surgery viewing, the surgery viewing, for like second year and stuff. And the standing was getting to me for real though. And I was back late and I was standing and no one can sit down and she can't
Right.
get up.
Standing.
And then I was there for probably like 5, 6 hours on my feet and I'm like, whoa, I couldn't understand how I could do this long term, like the standing, it was just too much
So,
for me.
so what you telling me that I need to start those leg exercises from now on?
Or invest in some comfortable shoes, some very comfortable shoes.
Yeah.
Right, right. So you mentioned your least favorite being medicine surgery and FDT for preclinical. So what is your most favorite thing so far for both clinicals and preclinicals?
So my favorite course would have to be anatomy. I love it. Anatomy of the I referred anatomy of the skeleton. That was very good. I love that course. Love everything about it. Learning. Like when you look and you think about how well the body is made, like to protect itself, to fix itself, how it works, it's amazing. And I absolutely love learning anatomy for that reason.
Tamara, why does it seem like you disagree?
Because I really don't like anatomy. Everybody knows this. It's like,
I saw it all over your face, like, really?
give me the physio, give me the pathology, and
No, no,
don't
no.
give me the anatomy.
Not at all.
Physiology stuff, I sit down and I'm like, how did you know this? How did you see this? Did the cell tell you that the cell does that? I'm joking. I'm joking. So anatomy is right there.
Right, right. That's how I look at it. It's just there, you just need to know it and you can see it. So,
Exactly.
So, Imani, in third year you did medicine, surgery, and
And aspects of family medicine, which would be community health and pediatrics.
how did you find those two?
So community health was laid back. We did a lot of field trips to different organizations that help, basically that you can refer patients to that need help, especially in cases of like child abuse and neglect, or if it is that you want to adopt a child or something like that for your patients. So I found it very informative. I didn't know the locations of a lot of these organizations and a lot of these homes that they have for persons that are on the street. So it was very, very good to learn that. But when it came to pediatrics, oh my god, this is where your history taking skills are going to be tested. It was like, oh, you didn't ask this, you didn't ask that, you should have asked this. And it kind of just made you realize how important, like, every single thing is, from birth history to diet history to immunization. But it was insane.
Yeah. I always think about pediatrics. I'm like, oh my god, how do you do this? Because the kids, most of them, even if they're small and they don't know how to express what they're feeling, like to, just use the parents' experience or
Mhm.
to make a diagnosis. I think that's the challenging part. So I always look at pediatrics and I'm like, this must be difficult.
Is and sometimes when a parent would say, "Oh, I don't see my child vomited," right? You would write that down. They don't want you to just write down vomited. They want you to make sure that it really was vomit and not just maybe sometimes regurgitate food, which is when they just open their mouth and the food comes down,
Mhm.
which would lead you along a different path in making a diagnosis.
Yeah.
So that whole thing about deciphering what the parent says from what the patient that can't speak
Mhm.
experience is so true.
Yeah.
You get it, you get it.
Yeah, I'm
No.
working on it every day. Well, not every day. When that rotation comes again. Or
So, Imani, so that kind of wrapped up what we have, most of the things we've been stressing you about so far. So, we're just going to lighten the mood a little bit and play a little game. It's never have I ever. So it's basically if you have done it, you say yes I have, and maybe a little explanation, or if you haven't, no I have not, and maybe a little explanation if necessary. So Damar, do you want to start with the first question?
Sure. So never have I ever skipped a rotation.
Oh.
Wardrobe.
Oh. Well, I have skipped a wardrobe.
Why,
Why?
miss? Why?
The study crazy. It's crazy. Like when it comes down to the why, I realize that someone says that they're talking about. I'm not from someone newspaper. He just go home and read.
Yeah,
Okay,
I
at
understand.
least it's for a worthy cause. It was to study, you know? It was a worthy
Exactly.
little cause. We can understand that. We can.
Okay.
So, another one. Never have I ever wanted to quit medical school.
Oh, okay, I got. Uh, I have wanted to quit medical school. Oh gosh,
Why?
I forgot. Because it just felt like it was too
Too hard.
hard. And I'm like, oh my gosh, I can't do this anymore. I feel tired.
I feel you. I feel you.
Right? It's like you're feeling our pain through the screen. Like, I'm so tired. I can't bother with this. We understand. We definitely understand that. Next one for you, Damar.
Alright, so next one. Never have I ever fallen asleep during class.
No, sir.
I have fallen asleep.
Okay.
What? Especially like if it's after lunch and you had like a solid lunch and then the
Yeah.
AC is on and then you just fall asleep.
Maybe the lights are off too sometimes.
Exactly. Do not don't help. So
Okay, I think we can wrap up with this one. Never have I ever given medical advice at a party, at just a social gathering, or just to your friends who are not in medical school.
no, I have given advice. A lot of people like, oh you're not there. I'm like
Yeah. Yes. But it's in there. Right?
you're sitting there.
I think
Okay.
most people think that because you're in medical school, you will have a better idea than they do. So I guess that's why they ask sometimes.
Yeah, I think it's normal. Like, you're studying it, shouldn't you know it? That's what is in their head, you know. You're studying it, you know. So
Right?
I have a rash here. What you think is this? You need to know it because that's what they're teaching you. That is in their head. But you need to tell them, well, I think you should go and check that out with a doctor. And they're like, what do you mean? But yeah. So Imani, we just want to thank you so much for coming today. But before we wrap up, we just want to hear something. One last question and one last little thing from you. Why do you love the D&N Medical Series?
Why I love it?
Yes.
When I started medical school, I didn't realize that there was actually a need for something like this within the UE community. Because you have other YouTube channels from like other universities or other like medical, communities, and you're like, what's for us? What do we have? How can I learn from someone else without having to meet them face to face because I'm far from you? You have people from all over that want to experience medical school. So to have this online platform where people can tune in, they can pause, they can replay, they can reach out to you guys for advice, I think this is very important.
Right,
Alright, thank you. That's a
right.
very good answer. As you said, thank you guys so much for coming. Thank you, Imani, for coming. And we just want to say we appreciate you coming out and just sharing your experience with us. And guys, that's the end of today's video. So don't forget to like,
Comment,
comment,
share, and subscribe to our YouTube
Or
channel.
you can. Until
Until
next
next
time.
time, see you soon.